Hello, my name is Sage McKee. I'm going to be doing my IV piggyback competency. I'm going to start by going over my doctor's orders and my MAR, making sure I have the correct patient, make sure I have the right medication, the right dose, time, and route. I'm checking for allergies, making sure that they don't have any allergies, which he doesn't, which is good. Checking to make sure that it is compatible with the primary fluid, which is normal saline, that is running, and I've checked in the book, and it is. Gentamicin, I'm making sure that my rate of administration is correct. I'm going to be doing 17 drops a minute or 100 milliliters an hour if you do by grab or by pump. Checking to make sure the rate of administration is correct for 2 hours. Checking for any precautions. We need to use caution in infants, children, and the elderly. And use caution in patients with end-stage renal disease. We're going to watch for decrease in urine output and rising bun. So when I check all that and make sure everything is good, I can get my equipment ready. So I'm going to go get my equipment. I'm going to wash my hands. Make sure I have everything I need. I have my medication. I'm checking the bag for any cracks or any cloudiness. I'm also checking for the expiration date and making sure that it is not expired, which it is not. Making sure that it is the right medication, 60 milligrams and 100 milliliters, which is correct. I have my tag, which I have labeled the name of the medication, 60 milligrams, my name, the date that I am administering it, the date that it is expired, and my patient's name. I can go ahead and put that on my bag. And that bag is ready. I also want to make sure I have a secondary tubing kit and alcohol swabs. And when I have everything I need, I can enter my patient's room. Hello, my name is Sage McKee. I'm a student nurse at MCC, and I'm going to be giving you your IV piggyback medication. First, can you tell me your name and your date of birth? I'm checking it on the wristband. I'm also checking it verbally to make sure there's 2 identifiers. Thank you. Can you tell me if you have any allergies? No allergies, good. I'm checking the medication up here, making sure it's a normal saline that is compatible with our medication. Checking for any signs of redness, swelling, warmth, or infiltration at the site, and there is none. So then I can start administering my medication. You're going to be getting gentamicin, and we're giving it to you because I assume you have some sort of infection, and it'll clear up that infection. And let me know if you have any pain during this. I'm going to wash my hands. Gloves on. So I've got my tubing. Medication, making sure that it is clamped. And spiking my bag. And I'm going to prime. And prime my tubing. Making sure there is no air in the line. Just a little bit. There we go. lower my primary. I want to make sure that it is getting blood return. Lower, make sure it's patent, which it is. And now I can go. Lower my primary, and I'm going to be attaching it to the port closest to the bag. So I want to clean the hub. For 15 to 30 seconds. Okay. And now I'm going to attach my secondary fluid. There you go. All right, and I'm going to unclamp it. All right, and now I need to set, using my primary, set my drop factor at 17 drops a minute. Let's see, my primary, check in here. Let's see. All right. Checking it. Okay. All right. Ready? Check the watch. Can you see it? I'm gonna start right now. Stop. All right, just 17 drops a minute. And I am again checking for any redness, tenderness, any signs of infiltration, any edema, and there is none. So I can leave my patient in the lowest position with wheels, locks, and call bell in reach, feeling safe and comfortable, and I will let that infuse. And properly dispose of my stuff. I'll leave, and I'll come back. Hello, my name is Sage McKee, student nurse. Can you tell me your name and date of birth? Identifying it with the bracelet and verbally, and making sure that all of the medication has infused. And I can perform hand hygiene. Gloves. All right. Off. This side. Take that off and properly dispose of. I'm going to bring my primary back up and return it to the rate of administration that it was previously at, and checking for any signs of discomfort, infiltration, redness, edema, bed in lowest position, wheels locked, call bell in reach, having the patient feeling safe and comfortable, and I will now go properly document.